Knowledge is power. If you can understand what's happening in your body, then you are in a position to make a change. Today is a very important discussion. It is around chronic pain. Welcome back to Mobility Mindset. My name is Adam, proud father, married to an amazing woman, fitness enthusiast, registered physical therapist. This channel is dedicated to those busy parents trying to figure out how to perform at their best in this crazy game of life. Chronic pain is different from acute pain. And this is a very important distinction to have when you are dealing with pain, because this is basically treated in a completely different way. Back when I started practicing over 12, 13 years ago, this distinction wasn't really completely made. We understood what we call central sensitization, and we knew that when something lasted for more than 6 months, it was deemed chronic. Research started to emerge around my 4th or 5th year practicing, and when reflecting on the year 1 to 5, there were a lot of patients that fell through the cracks. And this was often because these patients were dealing with chronic pain. We were taught a tissue model, meaning that if there was pain, there was some type of degenerative change that occurred in the tissue which was causing this pain. We now know that this is not true. Instead, we think of pain more so as a communication for protection. So when your brain perceives that there is a threat, potentially because of a past injury or just an overwhelming amount of stress and strain on your body, your brain communicates to you by sending you pain signals. I like to look at this as a stress recovery equation. I really have to think of this as an analogy so that when I educate my clients on this, they can understand it, because like I always say, knowledge is power. There are many inputs that can be considered stress, and your brain doesn't know the difference between physical and mental and emotional stress. Somebody could be walking around in life with heavy past trauma, and that alone has increased that awareness of threat. Our bodies are meant to react to stressful events. However, when the stress is consistently up, our body doesn't know how to react, and we end up having chronic pain. So if we think of this as a communication for protection, then how do we decrease that perception of threat? And this is what a lot of our treatments provide. One way to do this is by sending new sensory information into your nervous system, new inputs that your brain cannot perceive as threatening. Eventually, the movements and the behaviors that were once perceived as threatening can be deemed as less threatening, and hopefully we can get a decrease in that pain. So just imagine you own a home that gets robbed. What's the first thing you want to do? Probably buy a dog or some type of alarm system. What if the robbers are so smart that they get around that alarm system? Then what are you going to do? You're going to bar the windows, probably get a more sensitive alarm system, maybe buy 3 dogs. And this is exactly what happens. If you do not manage this threat over time, your pain system gets more sensitive and it learns how to become more sensitive. Now, if we want to manage our lives and live a good quality of life, we have to also understand that pain is normal. Like, it's there to protect us. If we didn't have pain, we would just potentially ruin our bodies. But we can't let it get away from us. So I like to think of this as a stress recovery equation. So what are all the stress inputs And then what are all the recovery strategies? If we can get a net surplus, so if we can be in the positive, let's say we take all the stressors, deem them as negative, even though that's not always the case. Sometimes we can have stress that is interpreted as positive, and with adequate recovery, it can make us more resilient. But let's just deem them as negative, and we categorize all of the recovery strategies as positive. Stress minus recovery equals, if we're in a net positive, then we're good. We will likely see adaptation from that stress, allowing us to become more resilient. However, if we don't do that and our stressors largely outweigh our recovery, then we will be in a net negative. And over time, it can potentially lead to burnout and more pain. Some stressors that you may think are positive are exercise, especially high intensity exercise, deep tissue massage. That can be stressful on our nervous systems. And also things like cold plunges and really high sauna. Although these things are considered hormetic stresses, meaning they can potentially lead to a positive outcome, we have to have that recovery piece. And the recovery occurs through sleep, adequate, optimal sleep, good nutrition, feeding ourselves enough food and enough proteins, micronutrients, minerals, and vitamins. If we can optimize our sleep, typically it's around 7.5 to 8.5 hours with adequate REM sleep and going through all of the sleep stages, then when we go to sleep, our bodies are repairing. This allows us to eventually get an adaptation to become stronger, more resilient, so that we can take on other stressors. Now, if we think of our stress load, our allostatic load, as a container, and we've got these hoses that are pouring stress in, and these stressors, like I mentioned, could be exercise, it could be financial stressors, which are potentially mental and emotional stressors. You have all of these pipes dumping, pouring in stress. As that increases, if we don't have the recovery, then it overflows. So we got to think of the recovery as boring holes in this container so that we have an outflow just as fast or even faster than the stress coming in. This will lead us to a net positive. This is what we're looking for. When we think of chronic pain, the research tells us that it's a lot more than even this. This is a good place to start. Our belief systems around why we're having pain can lead to whether or not we can manage the pain. Remember, pain is actually not negative. It's something that's good. We need it to protect ourselves, but let's not let our nervous systems give us too much pain so that we don't have a good quality of life. If your therapist or your pain specialist has not discussed this with you, you may want to think about seeing somebody else, because in order to manage your pain and get through this so that you can live a fulfilling life, you need to understand why you're having this pain. If this is helpful, click the like button, subscribe to this channel. I hope to get more content like this out. Remember, knowledge is power. If you can understand what's happening in your body, then you are in a position to make a change.